She's got some disc injuries to her lower back too, and she's been in here in the past for sciatica. So what we're gonna do for her is cold laser therapy. Okay, hello folks. So I just want you to take a look. We have her here. She had we'll leave her name anonymous, had a right hip replacement. And as you can see with her posture, she's kind of antalgic, leaning to the opposite side there, to the left side, the opposite side of the hip. She's got some disc injuries to her lower back too, and she's been in here in the past for sciatica. She's back with a little bit of sciatica and also some hip weakness. So,
left one,
yeah,
which is not replaced.
yeah, exactly, which has not been replaced.
Yeah.
So we've been working a little bit on the mobility with that. You have a class tomorrow, right? Are you taking a class with Marcos yet?
No, who's Marcos?
Marcos is our fitness instructor, so you can do online classes.
Oh, yeah?
And he'll help you work through some of that flexibility.
How do I get to Marcos?
I can sign you up for the class. You can also go on our website, synergywellnessny.com. $15 for a class, and it's done online.
Okay.
You just need a computer and a yoga mat, maybe a chair without wheels.
Okay, and I have a yoga mat.
iPad has a camera. You should be fine. Just have it on a stand, you know.
Okay, all right.
But yeah, that should be fine.
All right. Can I sit because my lower back is
You can. So what we're gonna do, we're gonna start you with. Are you having sciatica down your leg right now?
Not at this moment, but I did last night.
Last night down the left leg. Okay.
Right here.
Okay, so let's do this. Let's have you lay, since we don't like to keep you on your stomach too long, which side do you want to start on?
Right.
On the right side?
Yeah.
So the hip replacement side up? Okay.
Yes.
Go ahead and do that. You might want to come around here.
Okay.
So what we're going to do for her is cold laser therapy. So what we're going to do here is we have a couple of lasers we're going to be running on her at the same time. Just speeds up the healing time. This is a 25 watt right here. The one over there can switch from 25 to 50 watt. Any soreness in here?
No.
Good.
There is soreness
Right
where
there.
your thumb
Okay.
is.
And this is not the side of sciatica, so
Right.
I'm going to laser the sciatic side in some different areas on the bottom while you're laying face down.
All
here.
right.
You okay there?
Yes, good.
Okay. Tender there,
No.
there.
Little. That's tender.
Okay. And that's right where your hip joint is.
Okay.
So that's where you had your
Replacement.
surgery. Yeah, we're just coming in on the back end of it there.
Right. That was in 2019, February 4th.
Not long
Tomorrow.
ago.
No, it'll be 2 years
So
tomorrow.
now January 2021, for those of you who could be watching this months or years from now. Okay.
Unfortunately, I healed
So
well.
this is really good to do right before and right after your surgery.
Okay.
If you can avoid waiting, you're even better off that way. But
Yeah.
better late than never, they say, right?
I'm here.
Okay.
I could do it, should, would, or could, but I'm not. You know what I mean?
What's that?
I
What do you mean?
I should have continued with chiropractic treatment, acupuncture, and I
Physical
didn't.
therapy. Well, when did you have your surgery again? In 2019? In what month?
February 4th. It'll be 2
February,
years
and then
tomorrow.
COVID hit, and then it was too late.
Yeah, yes, exactly.
Yeah.
And I hesitated coming back because of
I almost
COVID.
tried to put 2 pairs of glasses on there.
Yeah.
Yeah, you missed that one. That was pretty fun.
Oh, you?
Yeah.
No, but I didn't come, I didn't go to anybody, you know, because of COVID, any doctors or anything, but I had to. And that's when I returned to Synergy Wellness.
All right. Well, we're always welcome you back. Okay, so we're
Thank
going to go
you.
over that sciatic
Yeah.
nerve pathway here on the left side.
Oh, good. It woke me up, but, like at 5:30 in the morning, which was okay.
Okay.
But, I mean, in terms of I
How
got
were you
some rest.
sleeping at the time? On your stomach or
I was sleeping on my left side
on your left side?
where
Okay.
I have the sciatica, and I didn't
Did
even
it-
know I was
Did
on
it
the
get
left
better
side.
if you switched over on the right side, or
A
is it
little.
hard for you to sleep on the right side because of the hip surgery?
It's hard, and I started getting pains on both sides then when I slept on my right side, so I stayed in the middle with 2 pillows under my knees.
You mean in the middle on your back?
On my back, sorry,
Your
yeah.
back, okay, with pillows under the knees. Good. That's
Yeah.
the best way to sleep, folks.
I wish I could.
That-
Hard.
Well, it's easier now, though, right?
Yes, because
Yeah.
of the pain, no pain when I do that.
Well, I want to explain to everybody watching. So she has, when she first came in, like, I don't know, 2 weeks ago, 3 weeks ago?
3 weeks.
3 weeks ago, she couldn't even lay down on her stomach for more than, I don't even know, a minute.
I couldn't, yeah.
Yeah, not even a minute. So what we had to do is we had to do cox flexion distraction on her side. And then after two visits or so, she was able to lay down, 2-3 visits, maybe a week or two, able to lay down on her stomach, for 5, 10, 15 minutes. Now she's able to, but we're not going to put her on her stomach. We're just going to keep her this way. It's more comfortable temporarily. But if she sleeps this way all night, you can certainly see how that can aggravate sciatica, especially if you have a disc, herniation in the lower back. Okay?
Can I say something?
Sure.
I noticed a huge improvement, and so does my husband, Farzad.
Mm-hmm.
The right hip after surgery was up and to the right. It was like tilted this way, and we're getting it back to almost where it belongs. You know what I'm saying? I don't know if you remember that.
Your pelvis, yeah.
Was that what it was?
I was adjusting your pelvis. I'm not adjusting into that hip joint itself because you had the hip replacement surgery.
Oh, okay.
But I do adjust the pelvis, and the hip joint attaches into the pelvis.
Yeah,
In the
because
acetabulum.
it helped a lot. I'm not
Okay,
as
great.
crooked. Yeah.
Good. We're going to keep working on that. And a lot of that crookedness, again, has to do with the disc laying on the nerve, and you lean to one side. So I'm taking pressure off the nerve with cox flexion distraction, healing and repairing the hip, the right hip where you have the hip replacement, all the scar tissue around it,
Yes.
and then calming the nerve, the sciatic nerve down with this laser down here.
Okay.
So we're kind of hitting the sciatica in 2 different ways, with cox
Great.
flexion distraction technique, with cold laser therapy,
Great.
and then we're also, while we're at it, addressing your hip replacement, all the scar tissue in that,
Great.
and
It's great.
the lack of mobility in both hips, really. It's not just one hip
No,
or the
it's
other.
true. It's true.
And then when we restore some of that nerve flow to the legs, that'll make it easier for you to lift your legs and have more strength in your legs as well. So that's, again, where the cox flexion distraction comes in
Yeah.
and continues to help improve these issues for
Right,
you.
right.
And that's why sometimes you're bent over if you've sat for a long time and stand up and you're bent forward, and it takes you a while to stand up straight.
Yes.
Again, that's a spinal stenosis from the disc injuries in your lower back.
Yes.
And again, cogs technique is the really what got you through all this. The laser is what calmed all this pain down quickly.
Great.
Remember, we lasered it a couple
Yes,
times
yes.
last week, and the pain just dropped significantly.
It's great.
So the mixture of the two is pretty powerful.
It is. It is.
Okay.
Great.
Any tenderness here?
When you touch, yes. Right, that bone there, yeah, it's tender. The surgeon, Dr. Windsor did all 3 of my replacement, the knees and the right hip. And
You did well, huh?
he did, yeah, and he said to me with the hip, he said, I did the best I could. I put in a very strong apparatus, different than I've used with other hip replacements, because I had necrotic flesh. And he doesn't know how I got that. Nobody
What?
knows. Necrotic in the
Flesh?
hip. Yeah, necrotic. It was necrotic in the...
Beforehand, you mean?
Yeah, and
Yeah.
he said, that happens to some... I said, is it a vascular condition? He said, no. I said, I don't have to
Yeah.
go to a vascular doctor, because I was worried. Is it gonna happen
No,
to the
you
other
just
hip?
let it degenerate. Also too much.
Too much.
Yeah.
I didn't feel that much pain. I woke up one day and I couldn't walk without a lot of pain.
The important thing for you now
Yeah,
is to focus on your balance
okay,
and your flexibility. So
all
we
right.
need you to get in your strength. So we need you to get your flexibility so you don't, and your balance so you don't fall.
Yes,
Okay?
yes.
And then end up breaking the other hip.
God forbid.
God
please.
forbid, exactly.
I know. No,
Or any other bone for that matter, okay? So
I know.
that's really important. Balance and then flexibility and strength will come together. So stuff
Okay.
that we need to work on with you, okay?
Yeah, I know. Oh Lord. I shouldn't feel sorry for myself though, you know. I tend to though. I tend to, you know, the thing that
No.
bugs me the most, it's not that I
You can do it. We're just gonna give you a little guidance, but it's gonna be you. You'll do it.
I hear you and I
You
want
have to.
It's the walker. I wish I could get rid of the walker.
Well, that's what we will get rid of. Once you can get your balance back, you won't need a walker.
I'm hoping and praying.
But you gotta do the balance work, the flexibility work, the strengthening in order to get rid of that.
Yes, yeah, the PT too, you know, which
So you hear that? That's a goal. We're gonna try to
All
get
right.
rid of this walker for her.
I wish.
That's
Oh, Lord have mercy. And
that's a
I'm
goal
losing
for
weight.
2021. How's that sound?
Beautiful. I
Okay.
don't care how long it takes if I could get rid of this walker, I swear.
Okay. I think that's a fair goal.
Even just temporarily.
We'll do another follow-up video in the end of the year, or when she loses the walker sooner, hopefully sooner, right?
It would be
We
nice.
got some time though. We got a full year, so I think we
know.
can definitely make that happen. Without a
Okay,
doubt.
I hope.
I don't see any reason
dear
why
God.
not.
I hope. See, when I walk without the walker, I feel this like cramping and spasms in my lower back. That's the only area, the lower back.
Okay.
And I have to sit for a moment. That's why I have the walker.
Okay. What have you walked recently?
Sorry.
No, I wouldn't suggest walking without, like with the snow out there right now,
No,
without the
no.
walker. But when it clears up in a couple days to a week, you'll be able to try it and see how you feel short distance
Yes.
without the walker.
Yes.
Maybe you bring a cane with you instead.
Yes.
Um,
I still have to sit though, Doc. Maybe it's imprinted in my mind.
yeah.
I have
And again, that's the stenosis that's bothering you.
Uh,
In the spine, yeah.
yeah.
Okay. All right. So now that we're done with laser,
Yes.
what helps her a lot, folks, is a little bit of ART. So we're gonna do a little bit of that.
What's ART?
ART is active release technique. It helps you with your flexibility.
Oh, okay.
We did that last time where you swing your leg. Stay right there in that position. Yep. You can just stay right there, Linda.
Can I, should I bring this up?
Oh, yeah.
All right, 1 sec.
Well, actually, here, just leave that. Actually, I'm gonna have to contact you there. So
Okay.
what I'm gonna have you do is bend this leg up. You're gonna swing that leg and just reach for the corner of the chair and then bring your leg back
Okay,
against mine. Good.
like that.
And brace yourself right.
Yeah, so I don't
there.
fall.
Exactly.
I almost did. Hold on.
I won't let you fall. Don't worry.
Oh,
Now,
all right,
here,
all right.
Put your hand there. I won't let you fall.
All right,
Good. And back.
and then
Excellent.
bend it up,
And then, yeah.
and then what? I'm sorry. Go ahead. The same.
Good.
Again?
Uh-huh. And this is the hip that she had the replacement in.
Oh,
A little sore, huh?
no, it's a
Uh-huh.
big stretch here to the
Okay.
tip.
Okay, now relax.
Okay.
Okay, now we're gonna go ahead to the other side. Now, last week she was doing this just so you guys could see. We did it a little differently with her last week. I don't know if you remember this, Linda. Last week we had it assisted, so we were putting your foot right here on the stool.
Yes,
And
yes.
I was having you do this. Whoop, sorry.
Yeah.
Go ahead, put your leg. I was having you do this with your leg
Yeah.
on the
you were.
stool.
Yeah.
Yeah, so now you're doing it on your own.
Oh,
Great job.
okay.
Okay, we're gonna have you flip over on the other side.
All right. Now I have to do this.
Get yourself decent, yeah.
Yeah.
Okay.
Now this is the hard part, but I'm
Now
gonna.
you can just turn over. Yep, I think that's the easier way.
All right. I put my leg down now.
Yeah.
The weakness. way too. Oh, God. Ooh.
Oh,
The right one's getting weak too. I feel weak because I didn't do exercise for 2 days. Nothing.
okay.
Just got up.
Move this
That's it.
walker that was soon to kick to the curb. Okay.
Wait a second, I'm not comfortable.
Okay, no problem. Take your time.
It's right there. Okay, now that's better.
Better? Okay, now we're going to do the same thing with this leg. You're going to swing it forward.
Yes.
And good. And back.
Ah,
Good. Good. This is her sciatic side. She does get sciatica down the other side, both sides, but it's
occasion.
worse the left side.
Yes,
right?
yes. It doesn't go down my right leg. It goes like it stays in the hip area.
Okay.
that-
Where you had your hip replacement.
yeah. Yes.
So
And it's not terrible.
years ago you used to get it down your right leg once in a while.
Probably.
And the other one? Good. And again. Okay, and one more. You got one more in you?
Yep, yep,
Okay, you got another one in you?
yep.
I always like to squeeze a couple extra out of it. One more?
Yeah.
Okay. Okay, now I'm gonna have you lay on your stomach.
Okie doke.
Telling you folks, 2 weeks ago she could not lay on her stomach
I
at all.
couldn't turn
30
either.
seconds maybe.
Wait a second. Hold on. All right. And it's actually comfortable.
Yeah, let's.
Want me to sit down?
Nope. Yeah, chin at the bottom of the paper.
Okay.
Yep. Okay, I'm gonna take your shoes off here.
Yep, yep. Go ahead.
Okay. So I know that all her lumbar discs are affected, all 5 of them.
Good.
Some people have 6.
Huh.
Most people have 5. And all 5 of them are affected. So we have to be very careful with flexion distraction technique, and you need to know what you're doing. Meaning you should not go below the disc, the last disc, or the top disc herniation. Otherwise they may not get off the table.
Oh, God. Remember, I have osteoporosis. That's really the bottom.
She also has osteoporosis, exactly. So we cannot put her on her side and do that typical. If we do it, be very, very gentle. But typically the best techniques for her are Cox flexion distraction technique and Thompson technique.
Okay. Is this a teaching video?
Yeah, this is a
great.
video of other people maybe
Great.
with the hip replacement or other people that have sciatica.
Oh, great.
Yeah, that's why I started my YouTube channel, just to educate people about alternative approaches to what they may be suffering from,
Yeah.
that the medical profession may not be mentioning or giving them an option for.
They don't.
There's a couple of big ones, like hiatal hernias and costochondritis, that they don't have any answers for. And there are techniques that we can do to help with that are very effective. So what we're doing here is her right hip is pulled, her pelvis is pulled back. But that doesn't mean her hip is. That means her hip is actually forward. So when I'm referring to the pelvis, I'm referring to the top up here. Up at the top of the posterior superior iliac spine, PSIS. Okay? So we just cock the table here. And we're just going to put that back in place. Good. Again, this is the surgical side.
Yes.
Sorry. Are you ticklish?
Yeah, but yeah.
My hands are cold too.
No, it's all right. I
Sorry.
don't. I can't help it. It's reflexive.
Yeah.
I can train
Okay, I'm gonna
it.
touch you now, okay?
Yeah,
Ready? Take
yeah.
a deep breath in and blow out. Good. not only are we dealing with disc herniations, but also spinal stenosis here. Okay, we're going to do a gentle adjustment here. Take a deep breath in and blow out. And for somebody with osteoporosis, this is a really great technique. This is Thompson technique, what I'm doing right now, mixed with a little bit of cox flexion distraction technique.
Right.
Now I'm going to touch on the side here, okay?
Right or left? Oh,
Both.
touch me, I see. Gotcha.
Yep, and your hips are much more level now.
Yes, yes. I'm happy.
All right. Now I'm going to be turn over on your back.
All right.
Actually, you know what? Here, let me do this with you face down. This will be easier for you.
Yeah. I
Right
know.
there. Feel that?
Yeah.
So we can use Thompson technique also in the neck.
Good.
Very gentle technique. Yeah.
Can we laser that or no?
You can,
Yeah.
but
Some other time.
I don't think it's
All
the
right.
appropriate thing to laser.
Okay.
It's out of alignment, so that's
Yeah.
what it needs. It needs to be corrected. And relax here.
No, that hurts, man.
Okay. Yeah, this one won't be as bad.
All
Ready?
right, yeah.
Take a deep breath in and blow out.
Ah!
Okay.
All right.
Is that one as bad?
No.
Okay, and we got one more here.
Oh.
This is called an activator. This is also something you can use on somebody with osteoporosis. Tender across here.
Yeah, yes,
Here.
yes.
Okay, that we can laser.
Right.
You can melt those trigger points away pretty easily. And that would be more effective than going right over the bone there in your neck, okay?
Yeah.
So there you are, folks. There are 3 really great techniques for people with osteoporosis and somebody that's had a total hip replacement. And activator, Thompson technique, and cox flexion distraction technique. Now we're just lasering some trigger points she has here. And you just relax there.
Yes.
All right. If you guys have any questions or comments, feel free to type down below. Let us know. Thanks for tuning in.